Digestive drugs by Douglas M. Borland. Podophyllum. The ordinary conception of podophyllum as a drug for summer diarrhea is far too restricted. Although it is immensely useful in summer diarrhea, it has a sphere of action very much greater than that. The type of summer diarrhea in children in which podophyllum is so very useful, in which there is the most profuse, very offensive watery diarrhea accompanied by the passage of a quantity of very offensive flatus associated with acute abdominal colic and with sign of very acute prostration. It is usually associated in these summer diarrheas with signs of certain amount of meningeal irritation, sometimes amounting to no more than a constant rolling of the head from side to side, though there may be actual retraction of the neck. Very commonly, this is associated with a constant chewing motion of the jaw. There may be actual grinding of the teeth if the child is little older, and not infrequently, there is a definite squint. It is not a true meningitis. On lumbar puncture, there may be slightly increased pressure, but no abnormal cerebrospinal fluid. This type of summer diarrhea does respond very well to podophyllum, but it is only a very small part of the story. You get indications for podophyllum in all sorts of gastrointestinal catarrh, very often with an extension up the bile ducts and a definite cholecystitis. Occasionally there may be indications for it in gallstones, although that is not so common. The patients mainly complain of constant discomfort after any food and feel as if they were stuffed full. With this feeling, they say that they cannot digest anything. Everything seems to turn sour. Associated with the spite sensation in the stomach, they have frequent attacks of acute salivation and belch up a quantity of sour wind. They often have a burning sensation in the throat and a burning tongue, accompanied by intense thirst and a desire for cold drinks. In all digestive disturbances, these patients get a very thickly coated tongue, particularly at the root. The tongue as a whole is often somewhat soft, flabby and pale, with a very thick yellow coating at the base. The vomit may be anything from sourish fluid to definite bile, depending on extension of catarrh, whether it is merely gastric or has spread down into the duodenum or involves the liver. When the liver is involved, they usually have pretty extreme nausea and aversion to every kind of food. They simply cannot bear the sight of it. They get a good deal of pain in the liver, which is very much worse from pressure. The pain extends right through to the back and is somewhat relieved by gentle stroking, particularly stroking from behind forwards in the region of liver. These somewhat jaundiced patients often sit up in bed, but stroking in the liver trying to shift something. They find some relief from it, although the subcostal region will be very sensitive to pressure. In the catarrhal attacks, the patients tend to be very depressed, almost melancholy, and if the pain is troublesome, they may become very fidgety and restless. In acute attacks, they frequently run a temperature and may then have profuse night sweats. There is more chronic condition with the history of patients having liver upsets, as they call them, digestive upsets, with a feeling of fullness in the upper abdomen and a general dragging sensation in the lower abdomen. With an attack of diarrhea, they get a severe dragged sensation in the abdomen and feel extremely faint. Before the bowels act, there is sensation of fullness in the rectum, with a good deal of generalized abdominal and gurgling. After the bowels have moved, they have a feeling as if the rectum would prolapse, an increase of the dragging sensation and a horrible feeling of faintness. In spite of their distress, they often say they prefer to have an attack of diarrhea because if they become at all constipated, they are liable to suffer from very severe occipital headaches. It is a sort of bilious sick headache which these people describe, with a loathing for all food, general depression and a disinclination to do anything. Typical podophyllum patients are sensitive to cold. Their attacks of colic are relieved by extremely applied vomit. Their attacks of diarrhea are likely to be precipitated by any acid fruit, sometimes by milk, and very often by vegetables of cabbage type. Not infrequently, these attacks of diarrhea occur in the early hours of the morning, between 2 and 5 o'clock. The diarrhea is very urgent, and if the call is not attended at once, there is liable to be incontinence. Occasionally, podophyllum is indicated for women who suffer from recurring attacks of diarrhea at their periods, where the patient has made rather a slow recovery after a confinement and has a sensation of abdominal drag all the time. She probably has a bulky uterus, and at the period the uterus feels very heavy. She may even have sensation of prolapse developing. This, associated with recurring attacks of diarrhea at the periods, will very often be controlled by Podophyllum, which materially improves the pelvic condition. One other condition in which Podophyllum can be very useful is the constant urging to stool accompanying rectal carcinoma. There is a history of alternating attacks of diarrhea and constipation, of pretty violent tenesmus at stool with difficulty in passing stool, of feeling as if the rectum were being forced out and a prolapse were developing, and of violent straining to pass a little offensive blood and mucus. This condition is frequently controlled by Podophyllum. Several rectal carcinoma have very materially diminished under the action of Podophyllum. It not only controls the discomfort but seems actually to control the growth. One old man had an extensive inoperable carcinoma. He had known that he had it for about 18 months before I saw him. His story was that he got recurring attacks of diarrhea and constipation, and when he was developing an attack of diarrhea he used to get awful rumbling and gurgling in his abdomen, and then a sudden urge to stool, which he could hardly control. The stools were offensive. He nearly collapsed after each action and often had pretty violent and painful tenesmus. He went on for 2 to 2.5 years on occasional doses of Podophyllum. He went slowly downhill. Incidentally, he died from an intercurrent pneumonia, which he developed while he was in the country. But from the time of my first seeing him, his carcinoma certainly diminished in size. When I first saw him, I could not insert the tip of my finger into the annular stricture. When I last saw him, about 2.5 years later, I could pass my forefinger through quite comfortably, and from being incontinent, he had regained complete control. He died on an intercurrent disease, and whether he would have recovered from his carcinoma had he survived, I do not know, but the amount of relief he got from Podophyllum was simply astonishing. The description of Podophyllum under the heading Digestive Drugs by Douglas M. Borland ends here. Thank you for visiting my channel. Goodbye.